The Ugandan Diaspora Health Network has designated January as Mental Health Awareness Month. Now, when we look at mental health and emotional well-being, this is a topic that still carries a stigma in many of our communities. However, this condition is also very common and affects 1 in 4 people in one form or another. Now, mental health is defined by the World Health Organization as a state of well-being in which every individual realizes his or her own potential, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to his or her community. In other words, mental health or illness for that matter, if unchecked, can affect the ability to live our lives to the fullest. Now, there are several potential triggers of mental illness. This could be a result of environmental risk factors that include a stressful work environment, such as discrimination, such as unhealthy lifestyles, physical illness, among others. Now, it could also be a result of psychological trauma that would include neglect, such as emotional and physical abuse, loss of a loved one, among other traumatic experiences. Now, it could also be genetic or biological in nature, linked to an abnormal balance of neurotransmitters. But ultimately, we no longer look at health as a mere absence of disease, but rather a state of complete physical, mental, and social well-being of individuals. In the Diaspora Health Network, in the month that we have designated towards mental health, some of the activities we have planned this month will include a mental health online workshop. This will take place on Saturday, January 19th at 2 p.m. We shall also reach out to our communities through other avenues that will include mental health awareness videos, education and sensitization materials. We shall distribute brochures. We shall offer screening tools, in addition to sharing information on affordable community mental health care resources and clinics. We shall offer peer support groups, child and youth development programs, among other interventions. But let's remember that mental health illness does not discriminate. It can affect any one of us, irrespective of our age, irrespective of our income, education level, or even cultural background. But it's also important to note that when diagnosed early and treated properly, many people fully recover from mental illness and are able to successfully control their symptoms and live full and productive lives. Us at the Ugandan Diaspora Health Network will continue to be on the front line of this issue, addressing mental health in our communities throughout this month of January. But we need your support. We need you to be engaged. Don't hesitate to reach out to us if you're interested in being part of our activities and community outreach efforts.